The problem I sometimes see with some people that are doing MMA training is they think that that's practical. And I'm like, well, that technique can 100% be negated by me just sticking my thumb in your eye. And yeah, that's not allowed in the tournament. I would get disqualified. You win the point, but I would win in the street.
Sure.
We don't start seeing patients until 9:30. I've seen patients at 8:45 because they said, listen, I need to be at work. Can I come in? And I know that they need my care. They need to talk to me. So I will make arrangements to do that. And I just see that there's a lot of people in the healthcare industry that don't go that extra mile. There are some, but there's a lot more that don't. I mean, you have some insurances that won't let you see a chiro and a PT on the same day, because they want to make it inconvenient,
sure.
So you only choose one of them.
And in Rhode Island, they're cutting back reimbursement for PTs again and trying to eliminate PTAs. Go! All right, so welcome, Dr. Matt, to the podcast.
Thanks for having me.
So I just want to manage expectations. So we're old friends. We go back a ways. So I may jump around a little bit. All right, but so you're a martial artist, you're a chiropractor, you're a single man in your 40s. Did I forget anything?
I used to be a comedian.
Used to be a comedian.
Yeah, not funny anymore.
That was actually pretty funny.
Yeah, I'm not. I used to. I used to do a lot of things. I was a firearms instructor. I don't do that anymore.
That's
I mean,
true.
I could still do. Martial arts is what I miss the most. So obviously we trained for almost 20 years before I moved to New Jersey to do more comedy in New York City, and that kind of slowed everything else down.
Sure.
And we can talk about that stuff as far as like not really getting into doing any more martial arts because going to an area where you don't know anybody, I have no problem starting from the bottom. That wasn't the issue. But what we trained in is so different than what everybody does in New Jersey now. So it was just a little.
Is it just
hard.
more Brazilian Jiu-Jitsu?
They're so much into just MMA school after MMA school. Anybody that's ever fought a single UFC fight once in their life,
that's a school.
They open up their own school and they get people in. And all the power to them. They're making money. It's a business, obviously, as we know. But it's not like what we did was. I mean, now it's in the name, realistic. It's that sort of thing. So it wasn't geared towards tournaments. So a lot of the stuff that I would want to do, even just talking with some of the fighters, I never went into the schools to actually train, but talking with some of them, and I would say, well, what would you do if all of a sudden that guy pulled a knife in the middle of your fight? Oh, well, we don't do that. That's, I'm like, well, but that happens in real life. Like that's what I used to train in. It was just survival. It was literally just how can I get home to my family, not how can I win this trophy or this gold medal that hangs around my neck. That's not what's important to me. It's important to you. That's great. But so I haven't done that in a while.
But I think that makes a good distinction.
It does.
I think that, we did martial arts before MMA was popular.
Yeah.
And I think MMA brought a lot of good training methods, a lot of good ideologies to how you should now train, right? Because even stuff that we did back in the day, it was more art. It wasn't as practical. MMA comes along and you understand the importance of jiu-jitsu on the ground, right? We did jiu-jitsu, but it was more stand-up. And how you training, right? Because you train like an athlete.
Yeah.
And even striking, putting those things together. Now I think it's at a point where somebody has to make the distinction how they want to train and what their objectives are.
Right.
So again, like you can use all those training methodologies, but like if you're doing it for self-defense, then you can't spend all your time on the ground. And a lot of stuff you would do at Brazilian Jiu-Jitsu, like I can counter by poking you in the eye, right? Especially if I have just a little bit of training. Now I have more than that training, but I'm going to bite you, right? I will break your fingers off.
It's really turned into more so now. There's really those almost just two avenues that you can go on. You can either do the real traditional martial arts, where it's rooted in history.
Sure.
Or you
go, which is fine.
Which is 100% fine. And there are people that have dedicated their entire lives to doing those styles, and they're beautiful styles, and they'll tell you that they have practical applications, and they do, but then there's the avenue of the mixed martial arts, the ultimate fighting, the
training by these rules,
training
one-on-one
by these heavy one-on-one. These are the techniques that are allowed. This is how you're going to win. This is how you're going to become a champion. And then in the middle of it, not even in the middle of it.
I think a third avenue.
The third avenue is just that realistic training of this is how you put somebody down as fast as possible to stay alive. And the problem is that the real traditional styles, they know that's not what they're doing.
Yeah, sure.
The problem I sometimes see with some people that are doing, MMA training is they think that that's practical. And I'm like, well, just like you said, that technique can 100% be negated by me just sticking my thumb in your eye. And yeah, that's not allowed in the tournament. I would get disqualified. You win the point, but I would win in the street.
Sure.
Or that technique that you just pulled, you can't do that on somebody that outweighs you by 100 pounds.
Right.
And they'll say, well, that's why there's weight classes. Like, okay, but they're not weight classes when you're getting mugged in an alley. And now we start to see that crime is up in a lot of areas for numerous reasons that we don't have to get into. But I think that the systems that we did and the techniques that we taught and that you still teach are so much more important now because of the environments that we're living in. And I like people to be able to make that distinction. And it just sucked for me that I couldn't find any place close to where I am, and given the schedule that I have at work, to be able to go. I mean, I work until 7 o'clock at night some nights, and the classes were starting at 7, and I'm a half an hour away, and I'm like, well, I can't make your class. I don't want to disrupt it. And so I just stopped training.
Yeah, and I think it's not because the MMA stuff wouldn't work, right?
Absolutely.
It'll work.
It will.
However, it leaves stuff to be desired because, okay, now, anytime someone has a weapon and you don't, you're at a huge disadvantage. I don't want to get in a fight at all.
Absolutely not.
I'd much rather give you my wallet or my girlfriend to leave me. I'm just kidding, not my girlfriend. That's a joke we use when we teach it. So I'd much rather give you my wallet or run away than try a disarm with a knife or a gun. However, if you don't train that, then you'd be like, cool, I'll just pull guard. No, you can't pull guard.
Exactly.
That's not gonna, you know what I'm saying? So it's not that they don't. It's not that it wouldn't work. But if you're talking about your objective, which is self-defense, and if you take someone like a middle-aged woman with 2 kids, right?
Yeah.
Do you think they're going to start striking from a clinch and get thrown? No. They want to do a choke defense, right? They want to be able to knee someone in the groin, elbow them, and then run away. That's what you need, right? So there's 3 distinctions. Yeah, there's that traditional.
I love those when we do those seminars, the rape prevention seminars at colleges, because it was, I felt good
leaving
when we left, because I said, okay, you know what? They at least have a couple of things that they may remember that will help them survive. Yeah. They'll never progress in a martial arts system knowing just 3 techniques, but those 3 techniques,
but they don't want to.
That's all they care about. Right. They just want to survive.
Yeah.
And that's what made me say, you know what? We're doing something good with this. And I was saying this to someone the other day. As much as I miss training, I miss teaching more, because I got so much more out of that. And because you have that feeling of accomplishment that you just helped somebody maybe survive an altercation that they may never get into. But if they do, that hammer fist or that elbow or just that pinch or claw or whatever will help them survive. And that's what we wanted to do. That's what our goal was. And we had fun doing it, but it was just
in a 60 or 90 minute seminar. And I think the biggest takeaway of this is that real self-defense doesn't take you long to learn. You just need a few techniques that you're going to do. Right?
It becomes second nature.
It does become second nature. So if it's a woman out there or anybody watching out there, and you just decide, anyone who ever attacks me, I'm just poking them in the eye. That's what you're going to do.
That works.
Right? And I guarantee you'll be way more successful just trying to poke people or be like a snake than not doing anything or freezing.
Waiting for them to throw the one attack that they need to throw for the one other technique that you know.
Well, that makes sense. Yeah. So basically what Sensei Matt's saying is basically like, well, if they do this, then you do this. And that's like the old school like martial arts. Like, and everything evolves. Yeah. And again, getting back to it. Yeah. So did like we include more ground game because of MMA? Yeah, of course.
We had to.
And you had to because other people then knew it. Right?
Yep.
But then what happens is, well, so now I know I have a great base. I don't need to know 35 setups for this arm bar. I just need to control you.
Yeah.
Pull your hair, hammer fist you, do whatever. Right. So yeah, there's definitely 3 distinctions in that. So, but let's go, let's change gears for a second. So you're using a cane now.
Yes,
right?
I am.
So fill me in. Did something happen, or are you just trying to get sympathy from the honeys?
No, definitely not. The pimp game is not strong. They don't. Nobody finds
care?
The cane attractive. Okay. Nobody finds the leg brace attractive or the limp. So I was faced with the fragility of the body and life and all of that. I was in an accident. Stupid, literally just 1 second I was as good as I've been, and then the very next second I'm on the ground, holding my leg. It was just a fall, just wearing. I was wearing shoes that you wouldn't wear to play outside. I was with my friend and his kids, and we were out in the backyard, and they were just running around playing soccer or whatever, and all they did was kick the ball over to me, but it was a little bit off to my right. So I went to just kind of do a little kick save, and the heel hit the wet grass. There was no grip on the shoe. I wish it was a cooler story. I tell people I was chasing a mugger, and I jumped off a building and landed wrong. But in reality, it was slipping and falling in my friend's yard. And what happened was, to keep it as simple as possible for your audience, I broke my leg. I broke my knee. The lower part of my leg, my lower leg, it broke, but it broke through the knee joint. As soon as it happened, my hands instinctively went to my knee because of the extreme pain that happened. And so I fell off to the side, but looking back on it, 6 inches to the right, my head hits the corner of his shed, and that's it, game over for me. So it could have been a lot worse. The noise that I heard, I thought I tore my ACL. I was convinced of it. He thought I was joking around. Thankfully, I was working with my friend who I was at my friend's house, and he worked with me. He's a PT, the chiro in our office. So I looked at him and I said, no, there's something wrong. I think I did something really bad. And so he helped me up. We threw some ice on it. He did a couple of ACL tests, and he was like, I don't think your ACL is torn. I'm like, well, I know I heard something. I heard a noise. Turns out that the noise I heard was the leg just crushing. The next day I went to the emergency room. I did drive home with a broken leg.
Sure. Well, you probably had a lot of adrenaline pumping.
It was insane, and also my OCD and everything. I didn't want to leave my car at his house. So I was like, I'm just going to drive home.
Yeah, priorities.
He followed me to help me in to my house. The next day I had two friends come by with a pair of crutches, and they took me to the hospital. They did an x-ray, they did a CT scan, and they came in and said, yeah, it's broken pretty bad, and you need surgery. Like, you can't do this without it. So I had to wait. Unfortunately, because there was so much inflammation, the surgeon, when I talked to him, he's like, I can't operate on you right now. We got to wait a week. So I had a week to walk around in an immobilizer brace with a broken leg. And then I had the surgery. The surgery was September 28th. So this week coming up will be 3 months from the surgery. I'm still a month out. I was only cleared to walk 2 weeks ago and to start driving. It has been ridiculous, but it showed me that there are more important things, because now I have a more positive outlook. I'm trying to do things for myself. Like I want to plan a vacation for myself at the end of 2023 because I never do anything for myself. I always do everything for everybody else. And so I started to realize that there were more important things, because I literally was 6 inches away from that's it. There's my obituary at the middle of 2022 because of some stupid accident. And
Would I have spoke at your funeral?
I mean, you probably, I don't know. It depends. I mean,
okay.
if you would have driven, I don't know. I think about I have a playlist. I actually have a playlist. My best friend knows this, that there are certain songs that I told her she has to put a slideshow together because I want people crying. I want so many people crying at my funeral. There's several songs that have to be played.
Like that Sarah McLachlan one with the
no,
dogs
not
are like
now, because
sad?
that one makes you think of the dogs.
Yeah,
No. It would be Fade to Black by Metallica. That's what I want to be lowered to.
Okay.
I want to be lowered to that one. The Lost theme.
Okay.
That one is big. That one, I think, if the right pictures are shown on my slideshow, that could get some people going. Don't Follow by Alice in Chains is another one.
You've thought about this a lot.
I did.
So tell me then. So how is going through the medical system for you? Did you have to be an advocate for yourself? Because normally you're on the other side.
Yes. So what's funny is that's the nail in that's a big part, because my dad happened to be, he was going to be stopping by and staying with me for a night he was driving down to Florida. And that's when this happened. So he ended up staying with me for a couple of weeks through the surgery, going with me to the surgeon. So he made a comment to me after that the surgeon didn't even talk to him. And I said, well, because he knew, like, I'm not elderly and I'm not a child. He knew he could talk directly to me. So I was my own advocate. I had nobody else talking for me, which was good. But then I started to see, I mean, you can't help but wonder about the bills. You can't wonder. So that first day when I went to the hospital, the emergency room, they told me, you have two options. The surgeon will be here tomorrow. So I was there on a Monday. This happened on a Sunday night. They said, the surgeon will be here tomorrow, the Tuesday, but he has 3 surgeries and he can talk to you at night. And he can maybe get you on for Thursday or Friday. Or you can go home tonight, see him in his office on the Wednesday morning, and then maybe he could get you in for the Friday, but more than likely it would be the following week. Now, ultimately, it was going to be the following week anyway because of all the inflammation. But I chose to go home because I didn't want that night stay in the hospital on that bill, because I knew it was going to be extraordinary. When I got my itemized bill, and thankfully I have health insurance through my job that covered the majority of what was done. But I see the amount of money that they charged me just for Tylenol while I was there. And I was like, how could people without insurance handle something like this? And most of the reason why mine was covered was because it was an emergency. It was an accident, and that's what was covered. Had I wanted to go in for like a hernia surgery that wasn't an emergency, that's considered elective, I would be paying for almost the entire surgery. So when I had talked to a doctor about that once, and he was like, well, right now it's not that bad, but you may have, at some point it might become an emergency, and that's serious. And I'm in my head saying,
they'll pay for it.
But that's when it'll get paid for. So you know what? I'll suck it up and deal with it.
So that's an interesting thing. So now that was an accident that happened.
Yes.
When and obviously we do jiu-jitsu, we do the fat loss transformation, the fitness transformations. So when I talk to women and try to educate them, it's like, okay, cool. So you have 2 options, right? You either pay the piper to stay healthy, get fit, eat well, or you pay it because you got sick.
Right.
Here's the thing though. A lot of women think that, I got insurance. And I'm like, okay, I understand that, but insurance is not going to cover anything of what you think it's going to cover. If you get diabetes, or you have a heart attack or a stroke, the amount of money that you'll spend trying to get better, and let's face it, it's very challenging to have those things and get back to your baseline.
Yes.
Right? You can, but like it's hard.
It's a lot more work. And you touched on a very good point, because we've heard it in the past. We've heard the phrase, we don't have health care, we have sick care. And that is extremely evident. I see it in my everyday job. I see people coming in, and I'm saying, you know what? If you came in on a periodic basis to stay healthy, it'll be a lot better for you. You won't have to miss work. I mean, this was an accident. This is different. But you won't have to miss work because your back is so bad that you can't go to work today. just come in and get regular care. But the problem is yes, their insurance, okay, I get 12 visits a year, or in New Jersey, Blue Cross gives you 30 visits a year. And I said, but they won't cover maintenance. So they don't actually want you to prevent getting hurt.
Which doesn't make sense because it would save them money in the first place.
Of course it would, because then they wouldn't need back surgery, which is going to cost the insurance company way more money. I mean, when I went in, I thought, like I said, I thought I tore my ACL. So I'm going in there saying, I need an MRI. That's what I need. Because an X-ray and a CT are not going to show the ligament damage. But they're like, well, I mean, because at that point they knew my profession. So they said, well, we have to do an X-ray first because of insurance purposes, because they don't want to, they'd rather just spend a couple of $100 on an X-ray than a couple of $1,000 on an MRI. When they saw the fracture, the next step on that is a CT scan, because they need to see the level of just how bad the fracture was. So after that, I said, okay, am I still getting an MRI? And the PA, he said, no, because now we know we have to go in there and do surgery. So if we see a torn ACL, we'll just fix it at that point. But there's no point in doing the MRI. And I'm saying, in my head, I'm like, but I want to know if I have torn ligaments. Thank God I didn't, because my recovery, I'd still be recovering, because they would have had to go in and do all that repair. I'm hoping that I'll be able to get back to doing some physical stuff. Like I said, I wasn't training anymore. I don't know that I'd be able to necessarily do that to the level that I did, but I want to be able to get back to the gym. I mean, I was up at 4:30 every day to be at the gym before work, and I can't do that. I've lost so much muscle mass that when I step on the scale and I see my weight's gone down, and I'm like, okay, but I don't look. And then I realized, oh shit, I just lost all muscle. Like my leg was just atrophied. I didn't use it for 2 months. And muscle, I know I can get back to it, but the muscle weighs more. So now I've gained some weight back. I mean, after my surgery, I lost 25 something pounds, like 25, almost 30 pounds when I would step on the scale. Because as I would start to get better, I had to do the dual scale where I'm standing all on one leg, and then I would slowly start to shift to start to put more weight on this leg. And I was like, oh my God, like I'm putting all of my weight on this one leg, and I'm 25 pounds less than I was when I stepped on the scale right before the surgery. Then as I'm doing it, now all of a sudden I'm like, oh, I'm only 10 pounds down from where I was at the surgery. So I must be putting on weight, but I'm not exercising. I'm not building muscle. It's just now I'm eating and I'm not exercising. And I'm like, well, I need to eat because I'm starving. But it's such a blow to your mind to be like, I need to really focus on getting myself better now. I need to really focus on that preventative care. Now I need to strengthen my legs so that this doesn't happen again. Thankfully, like I said, it's just a broken bone. So the ligaments are good. The knee will eventually be okay. But I need to work on my diet better. I need to do more of that prevention. But that's going to cost me out of my pocket, because I know my insurance isn't going to cover all of that prevention, and it stinks. But
that's something you have to do,
and I have to do it
because you'll spend more money later.
Of course.
And muscle is like the longevity indicator.
Yeah.
Right. So the more muscle you have as you get older, the better your quality of life.
Yeah. And now you start doing the CBCs and all that stuff, and I start to see, oh, the liver enzymes are high. Well, what's going to fix that? I don't drink. So I know it's diet. It's not alcohol. Yeah. It's just diet and exercise that I have to start doing more.
So a couple things, 2 questions. Do you have a different perspective now of being a patient like this? Because this is like the first time. And number 2, like, what did this injury teach you?
So yes, having to go through, having to be a patient, going in for my follow-ups and stuff like that, I will say that I am... At our office, we really focus on providing legendary service. We really want to be really taking care of the patient, not just taking care of the
meat market.
No, we want to make sure that we are always friendly. We are always providing them with options. We are always taking care of them, and that they are our top priority. I have seen now that is not always the case in other offices, because I have, with certain people, yes, they've made me feel like I'm welcome. Others, they are just pushing me through, And they're like, all right, just you're good, just hurry up, or just go sit there, or just go do this. And even just trying to schedule follow-ups, like just not friendly, not caring about, I'm trying to say, listen, I need to do this, but up until this next follow-up, I can drive myself. That's going to be the first one. I've needed to try to find travel arrangements to get to the doctor. And so I'll say, well, I really need to do it at a lunchtime because I can have my friend come get me on her lunch and bring me. Oh, well, we don't have anything. And I'm like, I know that you can fit me in because this is just a follow-up. This is going to be 15
And you're probably
minutes.
an easy patient.
I'm very easy. And I know how many times I have squeezed patients in. I've come in early. We don't start seeing patients until 9:30 in our office. I have seen patients at 9 o'clock. I've seen patients at 8:45 because they said, listen, I need to be at work. Can I come in? And I know that they need my care. They need to talk to me. So I will make arrangements to do that. And I just see that there's a lot of people in the healthcare industry that don't go that extra mile. There are some, but there's a lot more that don't. And they're like, listen, you're going to see me when I can see you. And that might be in 3 weeks. That might be in 4 weeks. Now, I was fortunate that our office has somewhat of a relationship with this other office. So when I called their office manager and was like, look, I can't keep waiting. I need to get in there and just.
Well, you shouldn't have had to do that in the first place.
I was like, I need to get in there. This is an emergency. It's a broken bone. I need to get in. And they were like, okay, we'll squeeze you in. Can you come at this time? Because he can squeeze you between these two people and shorten his lunch. I was like, yes, I'll do that. I will accommodate you for helping and accommodating me. What this has taught me, again, fragility of the body, how quickly something can change. And in general, I mean, you see people that die in car accidents, and that shows you one second you're fine, the next second you're gone. So it has taught me more about that. It's taught me to be patient with people. I always really try to do that anyway. I've always tried to put myself in their shoes. My all-time favorite show is Lost, and one of the things that
you look like the guy from that. I was about to say that. Who is it? Is it?
Well, there's Matthew Fox was Jack Shepherd.
You don't look like him.
Doctor. I don't look like him. I mean, listen, if I look like Sawyer,
it's not awesome. Sawyer. It's the other guy. The guy from Lord of the Rings. The guy from Lord of the Rings.
Gollum?
No. Was it name Dominic?
Oh no, I don't. No, Dominic Monaghan.
You don't think you look like him?
No, I don't think I look like him.
All right.
I think he does.
No, he's a good-looking guy.
But that show taught you, if you watch the whole thing, that everybody has a story, and somebody might be really upset or angry or whatever, and you have no idea what they're going through when you come across them. And to just be nice to everybody, because that person that's yelling at the cashier, they very well may be a jerk, but they may have also just had a huge loss in their life, and it's hitting them at the wrong time. So, I was very friendly to everybody at the emergency room and trying to keep an positive attitude, despite the fact that I knew my life was forever changed. Now, this cold weather, now I feel it in my knee. Like, that's going to happen forever. When they took my most recent x-ray, they showed me this is all arthritis. This is already starting. And I'm like, God damn, this is going to be horrible.
Older people move to Florida.
It is, right? 100%, because it's warm. They don't have that inflammation. This is forever. I mean, it's going to change. I mean, just the way that I didn't realize that I always stepped into the bath, step into the shower with my right leg. And now it's like, okay, now I have to step in with my left because I have to hold on to something to get my right leg up. So even little things like that, getting into the car is a challenge now.
Do you think you'll be a better practitioner now after this?
This is a new injury that I can sympathize with versus empathize. That happened because, I became a doctor at 25. So as I got older, the first time I really threw out my back, and I was like, oh, wow, okay. Yeah.
Were you a chiropractor at this time?
Yeah. I was in my early 30s, and I was like, oh my God, this is really hard. There's no way that I would be able to go and work or do something like that. Then all of a sudden that empathy becomes sympathy. And now I can say, I know what you're feeling when you tell me I can't get out of this chair, doc. Now I understand exactly what you mean. And I can still tell the ones that are over, embellishing their pain or whatever. And that's fine. They have a reason that they're doing that.
Such as like maybe don't want to go back to work.
That was a big thing when I was here in Rhode Island. It's one of the reasons why I wanted to move, because I wanted to get into. I'm in a multidisciplinary practice now,
which is nice. Yeah,
it's so much better.
So basically,
team.
There's PTs, chiros.
We have medical pain management. We have we have our MD. We have our PA. We have chiro, PT, OT, acupuncture, nutrition, functional. Everything's all together. Everybody's working together for the patient. That patient may come in and see 3 different providers that day. And we're all talking about that patient, so we all know.
It's almost like a hospital system in an outpatient.
It is, exactly, but it's an outpatient office, and that's what I wanted. And when I left Rhode Island, it wasn't really. Now you're starting to see some places like that, but it wasn't prevalent, and I wanted that. I didn't want people that came in that were like, "Yeah, I just need one adjustment and I'll be fine." I'm like, "No, you won't, because you're coming in here and telling me that you're a 10 out of 10 pain." I know my limitations. I know that I'm not going to be able to get you better in one visit if you've had this pain for 25 years. Like it took 25 years to get to this point. It's going to take a little while to get you back.
Yeah. And if they were a 10 out of 10 pain, like for us as a PT, that means like you need the ambulance, right? So you have to.
That's the other thing is I always tell them, I'm like, listen, I don't want to rain on your parade, but you're not a 10 out of 10 pain.
Yeah.
When this broke, that was a 10 out of 10 pain.
So, and again, even if you were 10 out of 10, I'd be like, Matt, so like, okay, does that mean I need to call the ambulance?
Yeah.
Well, a 10 means ambulance. Okay, I'm a 9. Okay. But like, could you even do chiropractic if they were a 10? Like, you're not going to cavitate them, crack them.
No, if they're a 10 out of 10, if they're, well, I won't use the numerical pain scale. If they come in there and they're in extreme pain and they're in a ton of spasm, I'm not adjusting. Yeah, right. I'm not adjusting them. I can't. I'll tell them, look, if I force this adjustment, we're both going to be in pain because you're fighting it. Your body is spasming. You don't want to be moved. I'm not going to try to force it to move because we're going to cause more problems. So let's try to relax these muscles first, see what we can do. And I'll let them sit there on heat for 15 or 20 minutes to try to relax that muscle. And if I still can't, I'll use an instrument to do the adjustment. I won't do a manual adjustment that day. I'll tell them, listen, come back tomorrow. I want you to go home. You're going to heat this again. Ice it if it's sore from the adjustment from us trying to move you, because there is going to be inflammation. But you have to go on that case by case basis, because I see doctors that are like, nope, we're going to adjust every single person that comes in the door. I'm like, well, there's some people that shouldn't be treated.
So this is my thing. So
first, do no harm. Remember, that's the first
do
thing.
No harm.
First thing of the Hippocratic Oath is do no harm to these patients.
So in PT school, I learned that PTs and chiropractors don't always see eye to eye, right? Our professions, in some instances, actually clash.
Right.
There's a couple of reasons for that. One of the reasons is our professions overlap, right?
They're two of the handful of conservative treatment methods. One of the things that I've seen, and they do clash sometimes because they both want the same thing for the patient, but they both feel that in certain instances, they both feel that they're the ones that can provide that. And if they can step back and say, you know what, if everybody works like what we do is I'll work on their spine. I don't do exercises with my patients. I send them to the PT department because I'm like, listen, that's what they're trained
because you have a PT
department.
Right.
And that's what I wanted, because I was like, I don't want to be. That's the hardest thing when we're hiring doctors out of school is I'll get some doctors coming in. And that's why I do look at where they went to chiropractic school, because I know that where I went to University of Bridgeport, they did teach that there should be a conglomerate and everybody should work together. But there are other schools, and I won't name them on your show, but there are other schools that say, no, you're the chiropractor, you can do all of it. But they can't. Like, there are limitations, and if you recognize your limitations, it makes you a better doctor. The best thing in the world a doctor can tell you is, I don't know, but I'll find out, as opposed to giving you some BS answer as to why they think you're in the pain that you're in. I'm fortunate that I can just literally walk 5 feet or 10 feet and say, hey, doc, can I put this patient on your schedule today or tomorrow? Can you do an eval and tell me what you think is going on? Because I have an idea, but I don't think I'm the only one that can help them. I think that they need PT. And if more schools, and also with your allopathic schools, if more MDs and your osteopathic schools. If the DOs came out of school knowing you all have limitations, like our MD, he's double board certified, pain management and physical medicine and physiatry. And he knows, okay, you need chiro, you need PT. If those don't work after a couple of months, then we'll start with some minimally invasive stuff like epidural injections and things like that. And then maybe we'll go to a radiofrequency ablation or neurotomy. And then if you're still not better, then we'll have you talk to our orthopedist about a possible surgery. But let's not go there. Whereas you have other doctors that come in and say, yeah, you're not doing chiro because that doesn't work. We're going to have you do PT for a month, and then we're just going to do surgery.
Yeah, so and total transparency, some doctors are totally against chiro and just send them to PTs.
Right.
I think the issue becomes with this, right? Again, we always want best for the patient, right? And we've worked with, you've sent me patients,
yes.
Right? I think it comes to two things. Number one, chiropractic is lobbied way better than physical therapy.
And neither one of them are lobbied as well as the AMA.
Yeah. But as far as physical therapy lobbying, it's abysmal, right? Anyway, that's number one. So I think PTs are like, well, chiros get this and then this.
The one good thing that you have that we don't is you get prescriptions from the orthopedists that tell them, listen, you need PT for your rehab. So the patient comes to you and already knows they have to come to you 3 times a week for 4 weeks because that's what the surgeon told them to do. What we see is then, the PT may say, okay, we're working on this, but, if it was a neck injury, say, but they're like, you're not walking properly because you're favoring this or you're favoring that. That's going to start to cause more back problems. Like, you don't want to have to go through this again. And then they'll say, why don't you go see Dr. Mendillo and just let him look at your back for a second. He's not going to touch your neck. Your orthopedist doesn't want him to touch you. That's fine.
At your place.
At our place.
Yeah.
And I'll be like, I will abide by those rules. I will not touch an area that you don't want me to look at. But I'm going to look at this because I think that it's important that you start to take care of other parts of your body. I've already seen it with me. Limping as much as I have, I see how I'm developing a hip issue on the other side.
So that brings it to the other thing. So let me go back for a second. I think the other issue goes to the back of chiropractors that just want to crack everybody.
Yep.
Right? So, and here's the thing, and you're not like that. So, as you already said it, I'll put them on a heat pack first to see if I can calm the muscles.
See if I can even relax them.
Yeah. Because the muscles are like ropes and pulleys. So if you cavitate them, and maybe you cavitate them through force, well, if you didn't fix the muscles, it pulled you out of alignment again.
Yeah.
So you literally just went right back. However, there are chiropractors like you who will be like, okay, I'll cavitate you, but let's stretch it.
Yeah.
Right? And I think both is really wonderful.
Absolutely.
The other issue is with insurance again. Cool. All right. So
you have some insurances that won't let you see a chiro and a PT on the same day because they want to make it inconvenient.
Sure.
So you only choose one of them.
And I don't know if this is nationwide, but in Rhode Island, they're cutting back reimbursement for PTs again and trying to eliminate PTAs.
So I didn't know that.
So let's talk about this for a second. So that means that you can't have Medicare won't pay for a PTA. If I'm understanding this correctly.
So Medicare will only let you get treatment by a PT.
Yeah, and what happens after Medicare does that? Every other insurance follows it. So you eliminate a whole profession.
Yep.
All right. Well, listen, if you're a PT, how many patients can you see?
Right. Well, and the thing is with PTs, if your patients are Medicare, you can only see one. Exactly. So you're saying, okay, well, I can only see this number of patients per hour
with no help.
With no help? How am I supposed to pay my bills? So what you end up having to do, again, like we're fortunate, we're in.
You make a meat market.
You have to, yeah. Or and even with some MDs, because reimbursement across the board is getting cut, all professions. And you start seeing your family medicine. I think that a couple of years ago, they had a big family medicine shortage. No kids coming out of medical school wanted to go into family medicine. They all wanted to specialize in something because the reimbursement to family medicine was ridiculous. So it forced doctors to have to see 70 people a day to make what they used to make seeing 45 people a day. So now that means your doctor is having his hand on the doorknob at 3 minutes into your appointment instead of 5.
And what quality of care is that?
No.
Now you're just wasting insurance dollars.
Exactly.
But the other thing is too, you would see it where, okay, you have the script from the doctor for a knee, right? The knee has pain. The insurance is like, I don't want you to touch the back. Okay, listen.
One region per.
What? Like that doesn't even make any sense, right? Because number one, if your knee is out, like it's probably either from the hip or the ankle if it wasn't an injury,
right?
But it goes up the chain, right?
Everything gets affected.
Everything's so like as a PT, like I can't treat your knee without treating your back because I know your back is compensated or I know your ankle is compensated. I have to treat the whole limb or actually the whole body to tell you the truth. I have to fix your posture. Now, through documentation, we can say why we're doing this, but like one region.
And you can only do it for so long because if you do it for too long, all of a sudden the insurance company is going to call you and say, why are you doing this?
And take the money out of your account.
We're not going to treat you. We're not going to allow this anymore. And you owe us money back because you were doing something we didn't want you to do. We don't care if that person gets better. We only want you doing what we told you we would pay for.
Which is crazy. Right? Because you can't do what's best for the patient.
And that goes back to sick care, not health care. They do not want people to be healthy. They do not want people to prevent injuries. They want to. I mean, then I saw one insurance company was advocating like a prevention model. They were saying this new program, but their prevention model was built around pharmacology. It was, well, your cholesterol isn't bad now, so start taking this before it gets bad. And I'm saying, well, why not just change your diet
and exercise, and you won't need any cholesterol medication. Prevention isn't taking medication before there's a problem. Prevention is preventing the problem from beginning and doing it the right way, not saying, oh, well, we're just going to use this medication, because medication is a crutch. It's no different than a physical cane or something like that. You want to not have the problem, not have a simple way of, oh, I'm just going to mask the symptom and then I don't feel the pain anymore, or oh, this pill is lowering my cholesterol, so I'm still going to go eat fast food 3 times a week. Well, why not just stop eating fast food? Because that medication that you're taking may have side effects that are going to cause other problems. And now you'll say, all right, well, my cholesterol medication gives me a headache, so then I take this pill for the headache, but that pill makes my stomach hurt, so I take this pill for my stomach pain. And it's like, well, if you fixed your diet and exercised more, you wouldn't need any of these medications and you'd just be healthy. And we know that pharmacology make one pill and then have side effects of that pill. So they make another pill that, right? So it's just this whole cycle.
$1 billion money runs everything.
There was a study done, and we've been, we say this in here, or at least I have been thinking about this and saying this, where like doctors would be like, okay, Matt, like you need to lose weight. Go lose weight. Okay? Like what?
Not give you any actual avenue as to how to do
eat healthier. And like, so like, this is what I do for a living, right? Fitness, self-defense, jiu-jitsu transformations. Like, I know this stuff, but I can't build a house. I'm not a chiropractor. I'm not a chiropractor. I'm not a construction worker. You wouldn't want me to build your house. Well, if you need to lose weight and you're not trained in that, where are you going to go? Right. You're going to go to the internet that has 35,000 different diets. You need to, the doctor needs to be able to say, okay, listen, you go see this guy who does transformations with people. Right. He'll give you the plan. He'll give you the workouts. He'll give you accountability. Yeah. It's like they tell you what you need to do, but they don't tell you how to do it. Right. Right. So they don't.
The nutritionists are, and oh, by the way, nutrition isn't covered by your health insurance. So now we want you to get better, but it's going to cost you money out of your own pocket. And then what does the patient say? Well, do you just have a pill that can help me 100%. Not lose weight? Yeah. And listen, I don't feel like spending the money.
And here's the thing I tell people. If there was a pill that helped you lose weight, everybody be on that pill. They don't have that pill. They just have people like me who do this. Right. Right? Yeah. Like that's the whole caveat.
And eating healthy, and then the other thing is eating healthy is way more expensive than eating garbage. Eating bad food is so much cheaper. You know, you go to Whole Foods, you want to buy nutritious, healthy foods, you're going to be spending it. Forget the fact of inflation and how a dozen eggs is $5 now. Even without that, you want to buy healthy organic vegetables and fruits and stuff like that. It's going to cost you way more than just buying sugary cereals and you know, pizza every night. I mean, you can get pizza for $7, a whole pizza. And if you don't eat it all at once, that can give you dinner for 2 or 3 nights. So now you just fed yourself 3 dinners for $7, or you could spend $15 on one healthy dinner that's really good for you.
But then you could get the $7 pizza and get the $500 diabetic medication for 40 years.
Yeah.
You know what I'm saying? So like it evens out. You either pay the piper now or you pay it later.
Yeah.
Right. So in 1 or 2 words, is the medical system broken?
Yes.
How would you fix it?
The best way to fix it is you have to revamp the whole system. A lot of the reasons why medical procedures are expensive as they are is because medical school is as expensive as it is.
Do you think college is a scam?
In a sense, yes. So the first line in my book that I am writing is a quote from Voltaire. And it is, the thing about common sense is it's not that common. Education is incredibly important. I always say if I won the lottery, the first thing I would do is I would go get more education.
But nowadays, if you want to be a doctor or you want to have this pathway where like there is a terminal degree, you're going to be a physical therapist, you're
Right.
going to be in whatever it is, you have to go to college. But for a lot of these degrees,
You don't.
how many people do we know have a communications degree?
Right.
What are you going to do with that?
Communications, liberal arts majors. I mean, they're so much in debt because they went to school because they were told they had to go to college. You can't go anywhere without a college education. Well, nowadays, a bachelor's degree is the way a high school degree used to be.